Okay, let's start. Good morning, welcome to all of you. I'm Brian Maguire, and I can see we have a number of, we have 20 journalists from across Europe currently online. Welcome to the EIT online press briefing. This is the first in a series of online press briefings for the EIT's community response to the current crisis. I'm delighted to be moderating today this event. It's such a critical moment for Europe. And the COVID-19 pandemic has tested Europe's ability to respond quickly to a fast-moving crisis. And Europe's economy, as you know, is under serious pressure today. And the European Institute of Innovation Technology will explain how innovation is key to Europe's immediate COVID-19 response, and how the EIT powers entrepreneurs and innovators as we proceed towards post-pandemic recovery. Today, we're joined by Martin Kern, Director of EIT, Jan-Philip Beck, CEO of EIT Health, Teresa Chavarria, a PhD, Director General of Planning, Research and Training at the Ministry of Health in Madrid, Spain, and she's working with EIT Health on the Making Connections project. Also, Francois Berger, leader of the NanoDX COVID-19 project, which is supported by EIT Health as part of the Rapid Response Initiative. Just before we start, let's do some housekeeping. The press briefing is currently being live streamed on EIT Facebook. A recording will be available on the EIT website afterwards for those of you who want to check for quotes. And after the initial remarks from EIT's community representatives, you'll have the opportunity to address questions directly to the speakers. Before the first Q&A, we'll change your status to enable the use of microphones. And in the meantime, please leave your microphones on mute. During the Q&A, please make it known when you want to ask a question, and you can do this by using the Q&A panel. Please introduce yourself, your name, and your media outlet. We'll also take questions starting with those who notify in the Q&A panel, and afterwards the mic will be open for additional questions when the chat list has completed. So thank you for your attention, and thank you also for joining us this morning. We really appreciate your time and the effort that you've taken to be here. Let me introduce Martin Kern, who's going to kick off this morning. Martin, the floor is yours.
Many thanks, Brian, and good morning from my side, and welcome, and thank you to all of you who've been joining this, which is actually the first EIT online press briefing during this ongoing pandemic. So we would like to discuss the response of Europe's innovators to the COVID-19 crisis And I would like to have many thanks to Jan Philipp Beck, the CEO of EIT Health, for being with us today, as EIT Health is really at the forefront of the EIT's crisis response. So let me start with some general reflections about what's the role of innovation and innovators in solving the crisis. First of all, the COVID-19 pandemic has really brought to us unparalleled disruption to our societies, not just from the health perspective, but also from the economic ones. This is really a truly global and historic event that we're seeing right now. And I think it forces all of us to reconsider and change the way we live and the way we work. So going back to things as they were in December 19 is really a very unlikely scenario. Therefore, the changes that are needed make innovation really the key to the solution of this current crisis. So at the first place, in the very first wave, it's of course about provision of needed care to patients, medical supplies, intensive testing. These are the crucial first steps. Later on, prevention of future outbreaks will be critical, but in particular, the support to the economic recovery and return to growth, to jobs, and to economic progress. And for this, in Europe, we really need very, very strong collaboration and to develop together, to identify, to research, but in particular to implement the solutions that are needed and to really bring them to the citizens. And the EIT community has a responsibility and has acted on that responsibility to make that happen. And we see innovation as key to resolve the crisis. If you take a picture for that, it's a bit like a train that's come to a halt in a tunnel. At the end of it is economic recovery, light at the end of the tunnel, and innovation is really what we need right now as the engine to get us there. So what has the EIT community done? So how have we responded to the crisis? You know, EIT is Europe's largest innovation network. We have almost 2,000 partners, 60 hubs all across Europe. So very, very strong and good basis for a coordinated response. We've been already in the last 10 years, of course, powering entrepreneurs, innovators, helping to bring products from the lab to the market and have done so for over 2,000 ventures, over 900 products and 1.5 billion euros of external investment raised into those ventures the EIT created and supported. So I think that's a very strong position to be in, to now respond to the crisis and also be a strong part of the solution to it. What we need from our innovators now is that they quickly bring the solutions to resolve the crisis and turn their priorities around and focus really on what is needed now by European citizens. And because EIT has always been focused on societal challenges, it is very well placed to do so. At the same time, of course, our innovators, our entrepreneurs have been the ones immediately most affected by the crisis. So investment pipelines have dried up, supply chains have been hit, there are no more orders being placed, innovations are on hold, universities are closed, labs are often closed, students had to disrupt their studies. So that's of course very, very difficult ground to be in, and something that we focused on straight away to avoid that many of the good work done, many of the ongoing work will actually be destroyed, if not only halted temporarily. So that has been the immediate response, but there was another amazing immediate response, which means a lot of creativity, a lot of resilience was unleashed throughout the community rather than resigning to the crisis. So for example, we have seen the use of artificial intelligence and big data to identify and track the outbreaks, support to the development of vaccines, disease models to inform the policy, and online hacks such as the one that is being organized by EIT Digital. So where the community gets together to work on solutions to combat this pandemic and to move forward. So more concretely, I would like to give you some examples of our response across the EIT community. And we've really tried to mobilize support from all across the community to tackle the challenges that Europe currently faces. As a first step, we initiated an immediate release of 100 million euros of funding for innovators that have been affected, meaning to pay much earlier some of the funds that the EIT has available to help the community with liquidity, which is absolutely short-term key for the survival of many of the ventures. We also immediately introduced flexibility to allow our 8 knowledge and innovation communities to reorient their activities. We concluded business plans for 2020 in the beginning of the year. And of course, as soon as they're concluded, they need to be now reviewed, because there's probably not a single project which is not in some way affected by the crisis. So we want to do that in a simple way, in a flexible way, and help for a rapid response. It goes without saying that some of the immediate challenges were also health related. So I'm very happy we have the colleagues from EIT Health here who will talk more about that. And I'm really proud that EIT Health immediately rose to this challenge and quickly generated innovative solutions to respond to the pandemic. There are many projects that have been generated in this way. I would just, for example, mention those that work on rapid testing for COVID-19, which of course is an immediate benefit and an immediate need that EIT Health could contribute to. So Jan-Philipp, Teresa, Francois will later on tell you more about their response to the challenges. Well, I'd like to give you a few other examples from across the EIT community. For example, EIT Digital has been immediately powering their startups that can make a difference in this time of crisis. For example, in the area of remote screening and monitoring of patients with milder symptoms to relieve the healthcare system. They already, and I mentioned that, organized a deep hack to work on solutions for the pandemic, in particular using data analysis. Also very quickly reoriented all their summer schools planned for this summer, and rather than canceling them, making them happen online, so that students can learn and can benefit from the courses. Other kicks have also been very fast. For example, EIT Food is working on reorganizations of food supply chains, reorienting fresh surplus vegetables and bringing them into food aid. One other example that I would like to give. And actually all the 8 EIT communities, including the very latest ones, such as EIT Urban Mobility, who only started in January, have contributed immediately with solutions. So for example, EIT Urban Mobility is looking on how we can recover confidence in the public transport sector to counteract the likelihood that citizens will go back to individual car traffic by being concerned about hygiene issues, for example. And of course, all across the EIT community, education is a major issue. You know, that's what sets the EIT apart. And there's of course now a huge opportunity to move to online education, and many projects that were already in the pipeline have been now accelerated on that. So that's just a very brief overview. You see other examples on the slides, and I'm happy to discuss them when we come to the Q&A and explore more. And we will have further virtual press briefings zooming in on some of the other innovation communities also in the future. So let me end with just stressing one last point, which is solidarity, because now more than ever, we need to work together. We build on each other's strengths, and we've actually seen that done in an amazing way across the EIT community, with many positive reactions, with a positive attitude to constructive cooperation and focusing on solutions. So like that, the crisis also brings out the best in all of us, and that's been really great to see. So as largest innovation network in Europe, we want to support the EU's crisis response as strongly as we can by working together across the borders, across the sectors, as we've been doing in the last 10 years. So thank you very much for following the EIT, and I look forward to your questions later on. Back to you, Brian.
Martin Kern, EIT Director, thank you for that excellent introduction. And now, journalists, if you go down to the bottom of your screen, there's a Q&A button. If you hit that, if you haven't already seen it, you can send us some questions now from Martin, and I'll give you a couple of seconds to do that. And if not, then we'll open the mic just for a few moments. We also have another short opportunity to ask Martin some questions later on. So you can find that if you go down the bottom of the screen where you go to screen share, and there's a Q&A button there as well. Any quick questions? Okay, so you just give a second. Martin, did you find it difficult to reorient the groups, the different communities, or was everybody already active and beginning to understand what was needed to respond to COVID-19 from the outset?
I think, of course, a very initial response was just to reorient the way we work as the KICs themselves, the staff in the KICs, the staff in the EIT, in the co-location centers, of course, had to adjust. But that was a very, very short phase. I think very quickly we saw the response saying, how can we contribute to the solution? How can we generate new projects? How can we reorient what we are doing? And in particular, the focus on how can we help the most vulnerable ones, our startups and students. So actually it was, well, of course, it was difficult, but it was also a very, very quick response, which I think is super positive.
Okay, we have a question here from Adi Gasco. Morning, Adi, good to see you online. How effective has EIT been in supporting cross-border solutions? The virus seems to be eliciting strongly national responses thus far. So how effective has EIT been in supporting cross-border solutions? Martin?
Yeah, I think that's what's in the DNA of the EIT, as that's actually the value added we bring by being a pan-European network. And I think that's a major advantage. Jan-Philipp will explain more when he describes his crisis response mechanisms, that we could immediately connect across the borders different players because we already have an existing platform of cooperation. So there was not a fallback into some sort of national response, but a continuous cooperation across Europe between EIT and the KICs, but also within each individual KIC. So I think that's one of the strengths that now came in our favor.
Okay, thank you. Another question from Ben Upton. Ben's asking, can you say a little more about the KIC's business plan, how the KIC's business plans will be altered as a result of the crisis?
So it's part of the very first crisis response. We asked all the KICs for an immediate assessment, risk assessment, how their activities will be affected. It became clear that that's very, very substantial. At an average, at least 30% of the projects will have quite substantial changes. And what we can do from the EIT side is to give flexibility to the KICs to reorient that funding rather than to say, okay, we'll simply not implement 30% of what we plan to do and delay it or postpone it, but saying, let's reorient those resources in positive actions. For example, focusing on the entrepreneurs, on the ventures, focusing on new projects that can now make a difference. Obviously doing so within the context of each individual KIC and its societal challenge. And that delivered the quite diverse picture that I showed you before, and actually quite an amazing response all across different areas that now need to be addressed.
Thank you. One more question, and then we'll move on to Jan-Philipp. Julio, we'll take your questions as well, Julio, and then any others for Martin, if you add them to the Q&A, and we can come back to those later on in the briefing. So just let's take this first question quickly from Anne Roy. Good morning, thank you for this presentation. Do you feel the ecosystem is now preparing for a reopening, and how? Any estimation of some eventual loss for now?
Sorry, I didn't catch the last part.
Sure. Any estimation of eventual loss for now? Losses that we suffered in the ecosystem?
Well, I hope there will be no losses in the ecosystem. There will certainly be a reorientation. That's what we see now, that many projects will have to be reoriented. There's also an opportunity to generate new projects. So that's how we have been approaching the topic, rather than trying to stop things, to reorient them and put them into positive action.
Okay, if any of you have follow-up questions to what you already asked, you can put them in the Q&A. If we have time to come back to them, we will. If not, we'll answer them for you after the press briefing. Julio Merivals, about confidence in public transport. Can you explain the main lines for the ideas EIT Mobility is working on?
So we ask all the KICs those questions first to see how their current activities are affected and what they could do more to address the crisis. So we are working also on a more substantial response in this respect. For example, EIT Urban Mobility immediately said this is one of the areas where, on top of what they already plan to do in the field of modernizing transport mobility in cities, they could especially now make a major contribution to rebuild confidence in public transport. So that's at the stage where they're now generating projects with their existing communities, but also beyond that to address this issue. So I cannot yet give you all the details of that project, but that's what they identified as one of the focus fields to work on.
Okay, thank you, Martin. We'll come back with some other questions for you a bit later on. Let's move on now to Jan Philip Beck. He is the EIT Health CEO. Jan Philip's going to speak about health innovation in the COVID-19 area, how the EIT health community is responding to the crisis. Good morning, Jan Philip.
Good morning. Thank you very much. Thanks to everyone for joining. Pleasure to be here. As Martin already introduced, we are the community that is focusing on health innovation. We've spent the past years of building this community that now makes up more than 150 strong organizations. And I think what we realize now is that there is, of course, a particular value at this moment of crisis that we are spanning so many different sectors and types of organizations. So, of course, we have the industry involved, and I can briefly share. I can share my screen here to give you just a snapshot of our community. So we got the industry represented, which is extremely important, but of course also universities. We got healthcare providers that are, of course, at the moment now at the forefront actually of tackling this crisis. We got payers involved, incubators, clusters, cities, so the public sector. So we span a lot of different sectors now that are essential to do two things. On the one hand, of course, to respond to the crisis immediately and tackle it on the ground and provide good care and relief to people and patients out there. But at the same time, they will also be instrumental in finding a more mid and long-term response. Now, what we have done in EIT Health immediately is to kind of embark on a bit like, let's say, two avenues. One is, of course, that it became rapidly now clear to everyone that in the mid and long term, the focus on pandemics, their prevention, their future management will be much more important than probably anybody would have thought just 3 months ago. And one of the questions earlier already mentioned was a question around pan-European learning. I think this is going to be absolutely instrumental. And I think at the moment, just due to the nature our healthcare systems are structured, a lot of immediate response is national and is nationally rooted. But we have to make critical steps now to more pan-European approaches, especially also in the mid and long term, especially also in the field of data. The Commission has launched also an interesting COVID-19 data platform. And I believe this is the moment where we need to learn from the crisis in order to also better predict and prevent and manage future outbreaks. Now, in the very short term, for us, the big question was, how can we actually support with our network the immediate response to the crisis? And we have taken a few key actions that we can speak about now, and where I'm really happy that I'm joined by Francois also and by Teresa, who can give us good examples. So we have, of course, made additional support instruments available to startups, but very importantly, we have simply started also to leverage our network. We'll speak about that towards the end of the meeting, because I think beyond just instigating projects, it's very important to bring people in touch and to see who has resources to offer, who has particular needs, and how you can make that connections quickly. We have then launched a call for rapid response activities. Now, rapid response means really being rapid. So we want to support activities that can actually still create impact in the year of 2020. Of course, in different areas. So diagnostics and testing is, of course, extremely important, just as one of the pieces. And Francois will speak about his project as well in that area. So for us, it's critical to maintain a portfolio of projects that can complement a lot of the actions that are out there that are regionally anchored. I think it's highly important to make sure that you have good connectivity to those that are actually treating patients, and that you're also strongly connected to those that really understand the needs in the public healthcare system. So without further ado, I would like to hand to Francois to give him some time to speak about the project that he's about to run. It's one of the 14 that we are that we have launched just immediately and that we will be supporting throughout this year. So Francois, if you don't mind, maybe jump in here.
Good morning. Thank you very much to give me the opportunity to present this project. So our challenge is to improve the diagnosis and prognostic investigation in COVID-19 infection. The very important bioclinical bottleneck are the detection of the virus when PCR is negative, detection of the virus in asymptomatic patients, but also the prognostic evaluation. This week, some immunomodulatory therapy were validated for immunological worsening. So we need stratification of the patient. And at the resolution phase, we need to detect patients that achieve protective immunity. And for that, the classical tests are not reliable enough, such as the serological paper colorimetric assay. So our solution is a next generation immunochromatographic technology that combines classical paper test with nanoporous silicon and proteomic-based test. Nanoporous silicon coming from electronic industry catch the low concentrated biomarker, stabilize them at room temperature, and also increase the in situ detection, for example, using mass spectrometry, a technology that is already IVD and used in the hospital. So using blood and saliva, this is very important. It should allow the detection of low concentration of viral infection, as well as giving prognostic information using both specific immunodetection, but also, and this is very important, specific proteomic signature. It is compatible with point of care management of patient. In this project, and this is also very important, we also include a global care integration with informed consent, ethical by design implementation, data privacy, and the integration of telemedicine. The partner, associate, and this is important, academic partner and company. So INSERM, Grenoble-Alpes University, the University Hospital, and for the company, MedImprints, that will produce nanoporous silicon, Vision for the telemedicine innovative strategy, and Biotem, which is a paper-based diagnostic company. Most of these technology are patented. We have prototype. We already have industrial production. So we hope that at the end of the project, we will able to have more accurate tests compatible with industrialization and dissemination at the European level, also implementing global care vision and protection for patients. To end this fast presentation, I would like to thank EIT Health, providing a very unique support for innovation at the European level that should be very useful to win the battle against COVID-19. Thank you for your attention.
Thank you, Francois. Let's bring back in Jan-Philipp also. So to our journalists, any questions for Jan-Philipp or for Francois? Put them in the Q&A panel, if you will. Let's give you a moment to do that. Thank you. Let's see. Also, we have a question from Stephanie. Just 1 second, Stephanie Price, who asked us earlier, and she sent this in ahead of the event. How will EIT, is for Jan-Philipp, how will EIT funding help address shortages in PPE across Europe? And will a localized approach be more beneficial in addressing these shortages? Jan-Philipp.
Yeah, thank you very much. Very good question. Yeah, I mean, PPE is massive, is massively short, and will probably remain this way over the next month. So we recognize that need. We have in the portfolio of the 14 rapid response projects that I mentioned, we got 2 that are specifically focused on PPE. So we can share those those information on that project, on those projects specifically. So one specifically looks at making new mask designs available, practically open source, easily local to easily do local production potentially, and I think that could be a very interesting avenue. Second project is looking at utilizing a new kind of fabric for masks that are approved for medical professionals, and also utilizing existing textile mills, not only in Europe, but also reusing fabric potentially in developing countries to ramp up production there, also on sites that have not traditionally been involved in this production, and enabling that. So I think these are 2 very interesting approaches. They have potential for scalability. So yes, this is the way we are approaching this topic. Needless to say, of course, there are issues around connecting global supply chains and so on and so forth at this moment in time that are not necessarily within our scope here of activity. That will, of course, also play a very, very important part in securing a massive PPE supply.
Thank you, Jan-Philipp. Any other questions? Yes, we have. So, Enrica, we didn't forget about your other question, but let's take this question to Francois Berger. When will the new diagnostic test be ready, Francois?
So a very important question. So thanks to the emergency strategy of EIT, we were able to start the production of the first prototype that we will have in 2 weeks. And also we had a support of the French FDA to have accelerated regulatory approval. So the clinical validation is very important, will start in 3 weeks after regulatory approval. So very fast production of prototype and clinical validation.
Excellent, thank you. We have one question from Martin. We'll bring that back in later on. It's from Berit, and another question from Adi. Maybe Jan-Philipp, you want to take this one? Adi asks, it's been noticeable how much faster health systems have been integrating new technologies, especially in areas such as telehealth and mobile monitoring. Do you think the speed will be maintained post-COVID? Maybe it'll be increased. And the sector is renowned for being very slow at integrating new innovations. So that would be nice. Yes, it would. Jan-Philipp.
Well, thank you for that great question. So I do think that traditionally in the core of our portfolio, we've been supporting a lot of projects in the space of e-health, telemedicine, all of these pieces. And I think that these technologies and their connected business and service models and so on will get a sustainable push. So if we can see any, let's say, opportunity, anything positive that comes from that I believe it will accelerate change right there where it was already needed before. So I'm very convinced that in the future we will see a dramatic acceleration in e-health, in telemedicine, and so on. And I think that was overdue, to be honest. And this is something that should be moving forward much faster now. If we look at the US, we already see this acceleration, but I think there's always a moment in such a crisis where the different parts of the puzzle, if I wish, from the regulatory side, the investment side, the innovation side, all get on one page together, right? And I think also on the regulatory side, you now see this is top of the agenda, and I believe that this will have a consequence in sustainable and lasting change.
Thank you, Jan-Philipp. We're going to ask you to bring in Teresa in just a second, just in case any linguistic queries about PPE, that's personal protection equipment. I know that the anachronisms are used in different ways, different countries. So personal protection equipment, and when you're watching the video back for quotes, you'll have clarity on that. Jan-Philipp, you want to introduce Teresa?
Yeah, sure. Just 1 minute. So I think I'm very happy that Teresa is with us today from the Ministry of Health in Madrid. Just as Teresa will talk a little bit about her experience in the network, what we did at the very beginning was to say, well, before launching projects or whatever, we really wanted to make sure that we can leverage the power that the network actually has. So we quickly ramped up the platform. We asked people to put their asks and offers in there. We got, I think, more than 200 that were submitted. And then we had local task forces as well in the different regions where we are active, and try to connect people, those that have something to offer of the various kinds and things. It could be lab capacity, computing, ideas, whatever it is, and others that need it in the response. And I think this has gotten a lot of traction. We of course now see the results coming up slowly, but I'm happy that Teresa is here to just talk about her experience a bit and the difference I think she's making really on the ground there. So Teresa, I don't take more of your time, please.
Thank you. Good morning to everyone. Thanks, Jean-Philippe. Thanks to the EIT Health Headquarters for inviting us, and to the CLC Spain also Coordination Center for inviting us to be here today. Well, I probably you're all aware that Madrid is one of the main region in Spain and one of the main regions in Europe that has a hard time with the COVID-19 pandemic. Our main challenges when we identified the first case was, well, first of all, the pandemic advance speed, also the scarce knowledge of the evolution of the disease and the lack of specific treatments. We also had problems with an access to the market of personal protection equipment, and also limitations to the access of market of ventilators. So this was our background when we started working against the pandemic. Let me share my screen just to show you some figures, some numbers of Madrid's situation. So today we have more than 6,500 cases, positive COVID cases. We have a total accumulated hospitalized patients of more than 40,000, accumulated patients in our intensive care units of more than 3,000, and more than 8,000 deaths. So it's been hard week since we started with the pandemic situation, and we have had to face a reorganization of our healthcare system. We first confirmed our first case the 20th of February, and in 8 weeks, we've had to pass with from 14,000 beds in hospitals to more than 22,000. We have had to increase in our intensive care units. We began with 540 intensive care units, and now we have nearly 2,000. And also we started the pandemic with around 1,000 ventilators, and now we have more than 2,000 ventilators. And also we have had to, well, let's say, innovate in organization structures, creating Nightingale hospitals, enabling medicalized hotels, acquiring protective equipment, increasing the number of diagnoses, and also increasing the number of projects presented and clinical trials presented in different calls, amongst them the EIT Health Rapid Response Call. And in this situation, for us, time was a priority. And this is this is what EIT Health, the Making Connections initiative, has helped us a lot. Because when you're facing a crisis such as the pandemic, the COVID-19 pandemic, it is very important to gain time. So in this regard, the COVID task force that I think Jean-Philippe mentioned a few minutes ago, I think it was a key to identify, to prioritize, and to coordinate initiatives that could help us tackle the disease, to face the disease. Initiatives related with health data, protection equipment, health equipment, process innovation, clinical studies. In Madrid, we had a problem with ventilators. As I mentioned before, it was very difficult to access the market of ventilators. And at some point in mid-March, we were not sure we were going to have enough number of ventilators needed to have the enough number of intensive care units. Our forecasts in intensive care units were difficult. We thought we were going to have a saturation of our intensive care units, and we were not going to be able to have ventilators. So these Making Connections initiative helped us to identify European initiatives and experts across Europe that were working in the innovation level of new, for example, sharing ventilators or projects related to the development of ventilators that were maybe working on animals, but that could be tried on people. The initiative also helped us to share protocols and knowledge with other experts, and also to state new collaborations, future collaborations. But I think that the main help was at some point to gain time to plan the next steps. Once you know if you can use an innovation in your health system or not, at least you can plan for the next step. So I think that maybe for us, this initiative and also the work that we've been doing within the framework of the EIT Health Initiative has been helpful to work together and work faster. I think it was Martin Kern that before mentioned about solidarity. I think it's moment for solidarity across Europe, but I understand solidarity not only in helping giving people what they don't have, but also in working together to help each other. So if we work together, we can help each other in a faster way and plan for the next steps.
Thank you, Teresa. Let me just stop you there. We're coming close to time. We'll get a few more questions in from our journalist colleagues. Any questions specifically for Jan-Philippe or Teresa? Please add them just there now. We have a question which is directed for Martin Kern. I'm going to put this one to Jan-Philippe in just a second. If you want to take a look at it, Jan-Philippe. And also one for Jan-Philippe from Chris Stockel-Walker. Chris is asking, there's been an increasing focus on secondary impacts of the coronavirus around health when we eventually get out of this crisis with regular treatments and hospitals downsized or halted. What does EIT foresee the impact of the €6 million being reallocated from other projects to rapid response being? Are those non-COVID projects paused and will restart with funding post-crisis, or are they cancelled? Jan-Philippe.
Thank you for that question. So first of all, maybe as a general remark, our other activities are by no means any less relevant, right? And the challenges that we have been addressing before, for example, in better managing and addressing chronic disease, and we talked about e-health, telemedicine, all of these pieces are not less relevant at all. So they remain in focus. The 6 million come from some additional funding that has been made available. I think Martin has hinted at that as well. But of course, also then there are some disruptions to projects that just cannot be implemented due to technical reasons. I mean, some universities, academic sites are closed. Some healthcare providers are not able to make studies at the moment because personnel is simply drawn to the front lines of care. So projects are not cancelled at this point in time. Projects are then merely paused. That, of course, also frees resources, and that's how those resources we reallocate to rapid response.
Okay. Anything to add there, Martin?
Yeah, maybe if you look at that a bit across the EIT community from the initial risk assessment we did, just to throw in some ballpark figures, it seems like around a third of the projects will have to be very seriously reoriented, if not cancelled, or at least not possible to implement them as planned in 2020. I think 1/3 will need some adjustments, and then it seems like 1/3 more or less will still be able to continue. Of course, it's still a lot of unknowns on how the effects will be. And if you think that we have a program in 2020 of 540 million euros of EIT funds, you can see that that's an enormous, adjustment to the program. I mean, hopefully we can be able to give you better numbers and then also more information about how we want to channel those changes into a positive response in a very short time.
Thank you. And just a quick comment from Jan Philip on this question from Berit. And I know it was addressed to Martin, but I think it's better addressed by Jan Philip. And when we go back to a previous question, previous experience with epidemics such as SARS and Ebola have shown that after the immediate response to the diseases, a lot of developing of new technologies has occurred. But as the situation stabilized and the attention to the diseases diminished, the sources of funding for maturing these new technologies dried up. How can it be prevented that the good work done, how can we ensure the good work is done when we go back to normal?
Yeah. Very important. So, I mean, just maybe a few thoughts on that. So, first of all, I think it is important that also we lift this to European attention. So, I think the learning from the crisis and then also future prevention needs to be moved there. I do believe, for example, that we can improve a lot in terms of preparedness, right? I mean, the stockpiling, for example, of PPE, so of the protective equipment, was also below recommendations at this point in time, and I think that is somewhat unexcusable. So I think that there will be learnings, and I think they need to be followed up, and I think that should also be done at international level. I think that when we talk about also, for example, vaccines and therapeutics, and so I also think that here we need to make sure that we have good coordination and overview of the different initiatives, that also potentially at European level critical investments might be supported where needed and to do so. But in the end, I think it's a common task not to forget about that, but to be really honest, the way this has hit us compared to SARS and others before is so dramatically different that I cannot imagine that anyone would just let this slip so easily. So I think also the economic consequences are so dramatic now that I think we all have to react. And if we look at other crises that have hit us before, take the financial crisis or so on, also those have then left their imprint at national and European level. And I'm quite sure that this will be the same with COVID-19. I don't think we're going to let this slip.
Thank you, Philip. We're close to our time right now, so I just want to take two questions here for Teresa, then final comment from Martin, and then any additional questions outstanding, we'll answer those. The press team will answer those directly to you immediately after the briefing, just to respect your time this morning. So Teresa, two questions, one from Julio and one from Piers. Julio asks, how many ventilators will be stored in Madrid after this crisis? I understand there are a lot now in production. Do you know the answer to that?
Well, we have projects of ventilators in production, and well, we hope that we store the ones that are not broken after the pandemic because they have a limited life. But of course, they will stay in Madrid, and of course, we will be happy to share with any region that needs them in the future, of course.
Thank you. And from Piers also, sorry, somebody else want to speak there? No, okay, so Piers, for Teresa also, could you give an example of process innovation that has been enabled by collaboration with the task force, and what has the impact been?
Okay, so well, the process innovation collaboration across the task force has helped. For example, the example that I just gave, the ventilators. So this task force identified that there was scarce literature in the sharing of ventilator system, and it helped us to get in touch with experts in the King's College and in France in the INSERM that were working in the sharing of ventilators with patients, with several patients. In the end, we didn't use this knowledge because it was very risky. It was not set up yet, and we didn't have time to do the trials. But it gave us time to plan for the next steps. So I think in the end, the success of these initiatives, of this task force, is not only do you use the innovation or the innovation process, is does it help you, the knowledge that you share, does it help you to plan for the next step? In the pandemic of COVID-19, time is gold. So the earlier you know the next step, the better you're going to fight against the pandemic.
Thank you, Therese. Nice comment to leave that on. Martin, final comments before we wrap up?
Yeah, thank you. First, to underline my agreement with what Jan Philipp said, saying that this crisis has been so strong, so hard. I also optimistic there will be no return to normal, and no good initiatives that are now underway will then be just forgotten. As I also said in the beginning, I don't believe that's a likely scenario. If we come to more concretely, I think one of the most important questions, how will EIT make sure our solutions are transferred to society and actually brought to the market? That's the actual key driver that we have, because to be honest, the solutions, innovations are only valuable if they actually reach the citizens. But for that, EIT is very, very well placed. So the example given is already in the education field. A lot of the activities now are so accelerated that they immediately deployed. So allowing students to have summer schools being done online through tools from EIT Digital has an immediate delivery to citizens and to society. Or if we take that example about urban mobility that we talked about earlier, if there is solutions to a more safe use of public transport, be it by implementing social distancing solutions or use of materials that have lower transmission rates, such solutions can then be spread across Europe from the EIT's network. So EIT Urban Mobility in this example has a cities club, but all the KICs have associated industry partners, investors, and of course also the public sector, who can also create demand for such solutions, for example, to public procurement. I think that's really what sets us apart, that we have those individual solutions, but then the network that can help to spread them across. And that's where we see the real acceleration factor that we can provide. So I would like to end with that. And thank you again, Brian, for the question.
Thank you. My pleasure this morning. Thank you to all our journalists online. Everybody seem to respect their time limits. Absolutely. Most are just dropped off literally right now. So thank you for all your time, and to all our panelists as well, to Martin Kern, Jan Philipp Beck, Therese Chavara, and Francois Berger, and to our press team as well. As promised, those who are still online, you can follow up directly with our press team. Outstanding questions will be addressed directly to those who asked them by the press team immediately after, and the Facebook recording will be available very shortly for those of you who want to take clips from that and use that for social media. You're very welcome to also. Thank you, and let's look forward to the next press briefing from the EIT team coming up soon. Have a good day.
Thanks, everyone. Thank you. Bye-bye.
Bye.